You know that feeling when you're trying to get your head around something complex, but you just want the essential information, the stuff that really matters?
Yeah, absolutely.
That's exactly what we're doing today. We're diving into a topic that might sound a bit, well, intimidating, but actually has some fascinating insights.
That's right. We're taking a really close look, trying to help you understand something that, while it's not common, it definitely sheds light on important aspects of, well, health.
And today our focus is feline restrictive cardiomyopathy, or RCM for short.
RCM, yeah.
It's a condition affecting cats, and you might not hear about it every day, but understanding it can be really, really informative.
Precisely. At its core, RCM is a rare primary disease of the heart muscle in cats. The key problem is really that the heart muscle struggles to relax properly between beats.
Relax, so it has trouble filling up again.
Exactly. It makes it difficult for the heart's main pumping chamber, the left ventricle, to fill with blood.
So wait, the heart can still squeeze, okay, like pump blood out, but the issue is with the refill part.
That's generally right, yeah. The sources we've looked at describe this as severe diastolic dysfunction. That's the technical term for the relaxation problem.
Diastolic dysfunction, got it.
And what's particularly interesting is that the main pumping chamber, the left ventricle, often looks structurally pretty normal.
Normal? How so?
Well, it's usually not enlarged or thickened, which you might see in other heart conditions. However, we very often see increased scarring inside the heart.
Scarring?
Yeah, what's called endocardial fibrosis, the scarring of the inner lining, and myocardial fibrosis, which is scarring within the heart muscle itself. And alongside that, there's usually significant enlargement of the atria.
The atria?
Yeah.
Those are the upper chambers, right?
That's right, the upper chambers of the heart. They get quite large.
Okay, so you've got this stiff heart muscle that can't relax properly and these enlarged upper chambers. That sounds like a recipe for trouble.
It is, unfortunately. The consequences can be quite severe, including advanced heart failure, a much higher risk of blood clots.
Blood clots? Wow.
Yeah, known as thromboembolic disease, and sadly, potentially even sudden cardiac death.
Okay.
So our mission today really is to break down the crucial bits about RCM, what it actually is, what's happening physiologically in the heart, which cats tend to get it, how it might be spotted, and the approaches to treatment.
Because even though it's uncommon, like you said, understanding it gives us valuable insights into feline heart health overall.
Exactly, and cardiac conditions more broadly, too.
Okay, so let's really focus on this idea of the heart muscle not relaxing. Why is that the fundamental problem in RCM?
Right, it all comes back to this impaired relaxation, the diastolic dysfunction. When that heart muscle can't relax like it should, the left ventricle just can't fill up with enough blood during that rest phase between heartbeats. And even if the squeezing function, the systolic part, is relatively normal or near normal, this poor filling means less blood gets pumped out to the body with each beat. It's inefficient.
So it's kind of like having an engine that runs fine but just isn't getting enough fuel delivered to the cylinders.
That's a really good analogy, actually, yes. And the physical changes we see in the heart kind of reflect this underlying issue.
Like the scarring you mentioned.
Exactly. As we said, the left ventricle isn't typically bigger or thicker, but that buildup of fibrous scar tissue, either in the lining or within the muscle, is a huge contributor to the stiffness.
Right.
Think of it like the heart muscle losing its elasticity, its flexibility, and the enlargement of the atria, those upper chambers. That's thought to happen because of the increased pressure building up in the left ventricle as it struggles to fill. It's like a backup, basically.
Ah, like a traffic jam caused by a bottleneck downstream.
Precisely. And the really serious consequences stem directly from all this. The heart's inability to pump enough blood effectively leads to heart failure.
Makes sense.
And then that sluggish blood flow, especially in those big enlarged atria, particularly the left atrium, well, that creates the perfect conditions for blood clots to form.
Which leads to that thromboembolic risk you mentioned.
Yes, exactly. Where these clots can break off, travel through the bloodstream, and block blood flow to vital areas, often the back legs.
Okay, wow. We're getting a clearer picture of what this stiff heart problem's filling, leading to failure and clots. Now let's dig into the why. What's actually causing this stiffness at a deeper level?
Okay, the pathophysiology, the mechanisms involved. Well, the sources point to a couple of key factors.
Right.
One seems to be an increased sensitivity to calcium within the actual heart muscle cells.
Calcium. I thought that was important for contraction.
It is absolutely crucial.
Yeah.
But if the cells become too sensitive to it, It can interfere with their ability to fully relax after contracting.
Ah, so it's like a muscle that just can't quite let go completely.
Exactly like that. The other major factor is the fibrosis we keep mentioning, that accumulation of scar tissue.
Right, the physical stiffness.
Yes, whether it's in the endocardium, the lining, or the myocardium, the muscle itself. This scar tissue just physically makes the heart muscle much stiffer, less compliant. And there's another characteristic sometimes observed, which is a disorganized arrangement of the heart muscle fibers themselves. It's called disarray.
Disarray.
Yeah, imagine the fibers aren't neatly lined up. It makes the coordinated action of relaxing and contracting less efficient, like trying to wring water out of a tangled up cloth versus a smooth one.
Okay, that makes sense. So it's a mix of things happening at the cellular level with the calcium and these physical changes in the heart tissue itself, the scarring and disarray.
Yes. And it's really important here to differentiate primary RCM, which is our main focus today, from RCM-like changes.
RCM-like, you mean restrictive features caused by something else?
Exactly. Sometimes other conditions can lead to a stiff ventricle and restrictive filling. Things like endocarditis, which is inflammation of the heart's inner lining, certain immune system disorders, or even the very late stages of hypertrophic cardiomyopathy, which is another common feline heart disease.
So in those cases, the stiffness is secondary.
Precisely. The restrictive features are a consequence of the primary problem. But this deep dive, we're really zoning in on primary RCM, where the heart muscle disease itself is the main issue, the starting point.
Got it. And the sources really hammer home that dangerous duo, diastolic heart failure, the filling problem, and arterial thromboembolism, those traveling blood clots.
They really are the major drivers of the poor outcomes we often see with this condition. The heart failure means the body isn't getting enough oxygenated blood, leading to symptoms, and the thromboembolism can cause sudden, devastating complications.
It certainly paints a stark picture of the challenges. Now, thinking about the cat's body as a whole, which systems are most directly hit by RCM?
Well, the sources clearly identify the cardiovascular system, obviously, as it's a heart disease,
Right.
and the respiratory system.
The lungs. Why the lungs?
Because the heart's struggle to pump blood forward effectively can cause fluid to back up into the lungs. That's pulmonary edema. And that, of course, makes breathing very difficult for the cat.
Ah, okay. So breathing problems become a major concern. That leads to thinking about genetics. Is RCM something that runs in families, passed down in cats?
That's a really interesting and important question. In humans, primary RCM often is considered genetic, and they've actually identified specific genes involved.
Okay. But what about cats?
Well, this is where it gets intriguing. The sources we reviewed explicitly state that specific RCM-causing gene mutations have not yet been identified in cats.
Really?
None.
Not yet. They do mention that primary RCM in cats can sometimes occur spontaneously, just out of the blue, or it can appear in multiple related cats, like in a family line.
Which suggests maybe there is a genetic link.
It does suggest a possible genetic component, yes. But the precise genetic mechanisms, the actual genes involved in cats, that remains a bit of a mystery. It's unknown.
Huh. So a familial tendency might be there, but the exact why in terms of genes is still an open question for cats. Makes you wonder what researchers are looking into. It absolutely does. It's definitely an active area of research, trying to pinpoint those potential genetic factors. Understanding the genetics could be huge for future diagnostics, maybe even prevention one day.
Okay, so it's fairly rare, hits the heart and lungs hardest, and the genetics are still fuzzy. Which specific cats are more likely to develop feline RCM? Is it certain breeds or ages?
Good question. The sources confirm it's uncommon overall. Reports suggest it accounts for somewhere between, say, 1% and maybe up to 15% of all diagnosed cardiomyopathies in cats. So definitely not the most frequent type.
1 to 15%. Okay.
And when we look at the typical cat affected, it tends to be middle-aged to older cats.
Middle-aged to older.
And there seems to be a slight predisposition in male cats. They might be slightly more likely to develop it than females.
Interesting. What about breeds?
Yeah, that's interesting too. Unlike some other feline heart conditions where certain breeds are known to be high risk, the sources note that for RCM, no specific breed seems to be particularly more susceptible than any other.
Huh. So it's not like, say, Maine Coons and HCM. It seems more related to age and maybe being male, but not breed-specific.
That's the current understanding based on the data we have, yes.
Right. Now, shifting gears slightly. If a cat does develop RCM, what are the signs? What might an owner actually see at home that would make them think something's wrong?
This is so crucial for owners to be aware of, the potential warning signs. The sources actually break these down helpfully based on whether the cat has progressed into congestive heart failure, CHF.
Okay, that makes sense. The signs would probably be worse if the heart's really struggling, right? So what might you notice before full-blown heart failure sets in?
Well, the historical findings, the things an owner might report, include just a noticeable decrease in energy, maybe lethargy.
Just not playing as much, sleeping more.
Exactly. General weakness, maybe unexplained weight loss over time, and sometimes even episodes of fainting or collapse. Syncope, which could point towards an underlying heart rhythm disturbance and arrhythmia.
Fainting's is scary.
It is. And another really alarming sign is the sudden onset of paralysis or significant weakness in one or more limbs, often the back legs.
Paralysis, that sounds like the blood clots you mentioned?
It very often is, yes.
Yeah.
A clot lodging and cutting off blood supply. It's called aortic thromboembolism, or ATE.
Okay, those are definitely signs that would send you straight to the vet.
Yeah.
What about when a cat does go into congestive heart failure because of RCM? What changes then?
When CHF develops, the signs usually become much more obvious, and often they heavily involve breathing. Owners might notice their cat having to really work to breathe, taking rapid, shallow breaths. That's tachypnea.
Labored breathing.
Yes. Sometimes fluid can build up in the abdomen, making the belly look swollen. That's a Sykes. You might even see the veins in the neck bulging. That's jugular venous distension.
Wow.
And in severe cases, a bluish tinge to the gums or tongue, which is called cyanosis. That indicates a serious lack of oxygen getting around.
Those sound incredibly serious. Emergency signs, really. So what might a vet find during the actual physical exam of a cat suspected of having RCM?
Well, again, the findings can vary depending on that CHF status.
Yeah.
In a cat that isn't yet in overt heart failure, the vet might notice the cat just seems a bit down or depressed.
Okay.
They'll likely find a faster than normal heart rate, tachycardia, maybe an irregular heartbeat, and arrhythmia. And they might hear abnormal heart sounds, specifically something called a gallop sound or gallop rhythm.
A gallop. Like an extra heart sound.
Exactly.
Yeah.
But interestingly, the sources point out that heart murmurs, those whooshing sounds, are actually uncommon in cats with primary RCM.
That's important, because you often associate murmurs with heart disease.
You do, but not typically with RCM. Now, for the cat that is in congestive heart failure,
What does the vet find then?
well, on top of the things like depression and tachycardia, they'll likely observe that rapid labored breathing, maybe even open mouth breathing or panting, which is very abnormal for cats at rest. They might see the cyanosis, the blue gums. They could feel an enlarged liver or detect that fluid in the abdomen, the ascites, along with the swollen neck veins. Listening to the chest, they might hear crackling sounds in the lungs, called crackles or rales, which indicates fluid.
From the pulmonary edema.
Exactly. Or the heart and lung sounds might actually sound muffled or quiet if there's fluid built up around the lungs. In the chest cavity, that's pleural effusion.
Okay.
And crucially, they might find those classic signs of a blood clot, the ATE, in a limb, paralysis or weakness, a very weak or absent pulse in the affected leg compared to the others, and the leg often feels cold and is painful when touched.
That paints a very clear and concerning picture of how this disease can show up. Let's circle back to causes briefly. We talked about the genetics being unknown in primary RCM in cats. Are there any other potential triggers or factors known?
Well, the sources really reiterate that the fundamental cause of primary RCM in cats is still, frankly, elusive, especially when you compare it to humans where specific genes are often involved. It's a big knowledge gap, an area needing research.
Still a mystery.
Pretty much for the primary form. However, the info does give a bit more on secondary RCM, the kind that develops because of something else.
Right, you mentioned late-stage HCM.
Yes, late-stage hypertrophic cardiomyopathy is specifically mentioned as one condition that can eventually lead to restrictive-like changes in the heart. And interestingly, one study mentioned in the sources suggested a possible link
Yeah.
between cats having had something called interstitial pneumonia previously, and then later developing feline endomyocarditis, which is inflammation involving both the lining and the muscle, and that potentially leading to RCM features.
Huh. So while the main type is idiopathic unknown cause, it seems sometimes RCM can be an endpoint or consequence of other issues, like severe HCM or maybe even certain inflammatory conditions.
That seems to be the case. It definitely highlights how complex heart disease can be and how different conditions might interact or progress over time.
Absolutely. Which underscores the need for careful diagnosis. So how do vets figure out it's RCM and not something else? What's the diagnostic journey like?
Yeah, diagnosing RCM isn't straightforward. The sources emphasize there isn't really a single, universally agreed-upon set of diagnostic criteria just yet. It's more about putting pieces together.
Okay.
So a big part of the initial process is ruling out other conditions that could cause similar signs. The differential diagnosis list is quite long.
Like what? What else could it be?
Well, other types of feline cardiomyopathies need to be considered like hypertrophic cardiomyopathy, HCM, dilated cardiomyopathy, DCM, arrhythmogenic right ventricular cardiomyopathy, ARVC, even unclassified types.
Lots of cardiomyopathies.
Yes. And then you also have to think about things like a myocardial infarction, a heart attack, though less common in cats than people, or even heart failure caused by non-primary heart issues, like severe hyperthyroidism or chronic high blood pressure.
So it's really a process of elimination first.
To a large extent, yes.
Yeah.
Systematically ruling out other possibilities, and initial tests help with that.
Like blood tests.
Exactly. Routine blood work, like a complete blood count and serum chemistry panel, plus a urinalysis, are usually done right away. These give a good overview of the cat's general health.
Checking kidneys, liver, electrolytes, that sort of thing.
Precisely. Looking for any concurrent problems that might be contributing or complicating things. And then there are more specific blood tests.
Which ones?
Well, measuring the T4 level, a thyroid hormone, is recommended for any cat over about 6 years old presenting with heart signs, just to rule out hyperthyroidism.
Because that can mimic heart disease.
It can cause heart changes, yes. And another test mentioned is cardiac troponin.
Troponin, isn't that used for heart attacks in people?
It is. It's a protein released when heart muscle cells are damaged. So measuring it in cats can be helpful if the vet suspects there might be myocardial ischemia, lack of blood flow to the heart muscle, or myocarditis, inflammation of the muscle. It indicates active damage.
Okay, so blood tests give clues and rule things out. What about actually seeing the heart? Imaging must be key.
Oh, absolutely critical. Imaging is where you often get the strongest evidence for RCM.
X-rays first.
Usually, yes.
Yeah.
Thoracic radiography, chest X-rays, they can show some really characteristic changes.
Like what?
In cats with RCM, because those atria get so severely enlarged, the heart silhouette on the X-ray often takes on this very round, almost globular shape. Sometimes it's described as a Valentine heart shape on certain views.
A Valentine heart, that's quite specific.
It is quite distinctive when you see it. And of course, if the cat is in congestive heart failure, the X-rays will also likely show signs of that fluid buildup, either in the lungs, pulmonary edema, or around the lungs, pleural effusion. You might also see enlarged pulmonary blood vessels.
So the X-ray gives you the heart shape and checks for fluid overload.
Exactly. That distinctive round heart can be a big clue pointing towards RCM.
But the definitive picture comes from ultrasound, right? Echocardiography.
Yes, echocardiography, or an echo, is really the cornerstone for diagnosing RCM, even though, as the sources mentioned, the absolute definitive criteria are still debated a bit among experts.
Okay, but what does the echo typically show? What are they looking for?
There are several key findings, both anatomical, structural, and functional.
Let's start with anatomical. What does the heart look like on echo?
Okay, so anatomically, a really consistent finding is severe enlargement of both atria, the left and the right. But crucially, the left ventricle, that main pumping chamber, typically appears normal in size, and its wall thickness is usually normal too.
So big atria, normal ventricle, that's different from HCM where the ventricle walls are thick, right?
Exactly. That's a key differentiator. Also, on echo, you can often actually see evidence of blood clots, thrombi, or at least swirling blood flow within that hugely enlarged left atrium. That swirling is called spontaneous echocardiographic contrast, or smoke.
Smoke, because it looks like smoke swirling.
Precisely. It indicates very sluggish blood flow, which is high risk for clot formation. Sometimes you can also see prominent bands of tissue stretching across the inside of the left ventricle.
Bands of tissue.
Yeah, sometimes called moderator bands or false tendons. In some RCM cases, these can be quite thick and might even seem to narrow the ventricular cavity. Vets might also spot localized areas within the heart muscle that look brighter, more echo-dense, which could represent scarring or fibrosis from past damage.
Okay.
And interestingly, there's a subtype called myocardial RCM, where the main issue is within the muscle itself, and in some of those cases, the heart muscle might actually look fairly normal structurally on the echo, even though it's functionally impaired.
Wow, so it doesn't always look obviously abnormal structurally.
Not always, which adds to the challenge. And finally, the echo can easily detect any fluid around the lungs, pleural effusion, or around the heart itself, pericardial effusion.
Okay, that's a lot of structural detail. What about the functional information? How does the echo show how the heart is working, or rather, not working well in RCM?
Right, the functional assessment is key for identifying that restrictive filling pattern. Echocardiography uses Doppler, among other techniques, to measure blood flow and tissue movement.
Doppler, like for weather.
Similar principle, using sound waves to measure flow speed and direction. In RCM, the echo typically reveals severe problems with how the left ventricle relaxes and fills.
The diastolic dysfunction again.
Exactly. This shows up in specific measurements. Things like an increased E to A ratio on the mitral inflow pattern, a shortened isovolumic relaxation time, a rapid deceleration time of the E wave, and an elevated E to E prime ratio, which compares blood flow speed to tissue movement speed.
Okay, those sound technical, but basically they quantify the stiffness and poor filling.
It's exactly what they do. They give objective evidence of that restrictive physiology. In contrast, the systolic function, the squeezing part, is often normal or maybe just mildly reduced, although in some advanced cases it can become significantly impaired too.
Right.
The echo might also show regional wall motion abnormalities, meaning some parts of the ventricle aren't moving as well as others. And it usually confirms that severe enlargement of the left atrial appendage, that little pouch off the atrium, often with that smoke indicating stagnant blood.
High risk for clots again.
Very high risk. And in those cats, with the prominent bands inside the ventricle, sometimes the echo can show evidence of obstruction to blood flow within the ventricle itself, mid-cavity obstruction.
So much information from one test.
It really is incredibly valuable. And importantly, if it's secondary RCM, the echo might show signs of the underlying disease, like thickened walls and late-stage HCM. But that severe atrial enlargement and the restrictive filling pattern will almost always still be there.
That makes sense. So echo is central. Are there any other diagnostic tools used routinely? What about an ECG?
An electrocardiogram? ECG, yes, that's often done. It records the heart's electrical activity. However, the sources are pretty clear that the ECG findings in RCM are generally not very specific. They don't definitively point to RCM over other conditions.
Not specific, so what can it show?
Well, a fast heart rate, sinus tachycardia, is very common. Although, interestingly, in cats with a really severe CHF who might also be cold hypothermic, the heart rate could actually be slow, bradycardic. You can also see various arrhythmias, irregular heartbeats like premature beats, or sustained rapid rhythms like atrial fibrillation or ventricular tachycardia. The ECG might also show patterns suggesting enlargement of the atria or ventricles, or sometimes changes in the ST segment or T wave, which can indicate stress or damage to the heart muscle. But again, these aren't unique to RCM.
So helpful for identifying rhythm issues or electrical changes, but not diagnostic for RCM itself.
Pretty much, yes. It adds pieces to the puzzle, but doesn't solve it on its own.
Is there any way to get a truly definitive diagnosis then? A gold standard?
According to the sources, yes. A definitive diagnosis requires histopathologic examination.
Histopathology? You mean looking at the tissue under a microscope?
Exactly. Analyzing a sample of the heart tissue itself. This usually means getting a cardiac biopsy, typically of the endocardium and myocardium.
A heart biopsy? That sounds risky in a sick cat.
It can be, yes. It's not always practical or safe to perform on a living animal, especially one that's already unstable. So often, the definitive confirmation comes from post-mortem examination if a cat passes away or is euthanized.
Okay. But if you could examine the tissue, what would confirm RCM?
Key findings would include things like an overall increased weight of the heart, that severe enlargement of both atria, maybe a thickened, opaque look to the endocardium, the inner lining. You might see those fibrous bands, the false tendons, the main pumping chambers, the ventricles, would usually be normal in size unless there's concurrent CHF or maybe secondary RCM.
Then under the microscope.
Microscopically, you'd look for that disarray of the muscle fibers, an increased amount of fibrosis or scar tissue, both within the muscle bundles and between them, maybe abnormalities in the small coronary arteries within the heart wall. Sometimes signs of inflammation might be present, but often, especially in cases dominated by endocardial fibrosis, inflammation can be minimal or even absent.
So the tissue sample gives the final answer, but it's often hard to get in a living patient. It really drives home how tricky diagnosing RCM can be.
It absolutely does. In practice, the diagnosis often relies heavily on integrating all the clues: the cat's history, the physical exam findings, and especially those characteristic echocardiographic features, all while carefully ruling out the other possibilities.
Right, putting together that puzzle. Okay, so let's say a cat has been diagnosed with RCM based on all that evidence. What happens next? What are the treatment options?
Well, the approach to treatment really depends on the cat's current state. Is it in acute, severe congestive heart failure right now? Or is the disease more stable, maybe causing milder signs or diagnosed before CHF develops?
Makes sense. So what if it is severe CHF? What's the immediate plan?
For cats in severe CHF, hospitalization is almost always necessary for intensive care and stabilization. If the signs are milder, or if the cat is stable after initial treatment, management might be possible on an outpatient basis.
Okay, let's focus on that hospitalized cat in severe CHF. What's the immediate care involved?
The main goals right away are to improve breathing and reduce the workload on the heart. So that usually means supplemental oxygen therapy.
Oxygen cage or a mask?
Yes. Often sedation is helpful too, to reduce anxiety and stress, which makes breathing harder. Then medications are crucial. Drugs to reduce the amount of fluid the heart has to pump against, mainly diuretics.
Diuretics like furosemide.
Exactly. Furosemide is key. And if there's a lot of fluid buildup around the lungs, in the pleural space, physically draining that fluid with a needle. A procedure called thoracentesis can provide immediate relief and help the lungs expand.
Oh, okay.
Intravenous fluids are used very cautiously. Only really if the cat is clearly dehydrated and showing signs of poor kidney function. Otherwise, you risk worsening the fluid overload.
Right. Adding more fluid seems counterintuitive.
It usually isn't heart failure. Minimizing stress is also huge. A quiet, calm environment, providing warmth if their body temperature is low, and constantly monitoring their respiratory rate in effort to gauge how they're responding to treatment.
So, stabilize, get the fluid off, ease breathing, reduce stress. That's the immediate plan.
What about once they're hopefully more stable? What are the longer-term management strategies?
Okay, for ongoing management, especially after a CHF episode, strict rest is usually recommended initially. Confining them to a cage or small room helps minimize cardiac workload.
Keep them quiet.
Yes. Ensuring they eat is also vital. Sometimes in acute failure, they might need tempting foods or even hand feeding for a bit. And then client education becomes absolutely essential for long-term success.
What do owners need to know?
They need to understand exactly how and when to give all the prescribed medications. They need to know what potential side effects to watch out for from those drugs. They have to ensure the cat has consistent access to food and fresh water. And really importantly, they need to learn how to monitor their cat's resting respiratory rate at home.
Counting breaths per minute while sleeping. Exactly. It's one of the best ways for owners to track fluid buildup. If that resting rate starts creeping up consistently, it's often the earliest sign that heart failure might be worsening, and they need to contact their vet.
That puts a lot of responsibility on the owner, but it's critical for managing this at home. Okay, let's talk about the specific medications used. What drugs actually help?
All right, so there are several classes of drugs. For acute CHF, as we said, furosemide is the main diuretic, usually given by injection initially for rapid effect, then often transition to oral tablets.
Okay.
Nitroglycerin ointment can sometimes be applied to the skin, typically inside the ear flap, to help dilate blood vessels and reduce the heart's workload, though its effectiveness is debated. Oxygen therapy is key acutely.
Right.
If the cat's blood pressure is dangerously low, contributing to poor perfusion, a drug called dobutamine might be given as a continuous intravenous infusion in the hospital to help strengthen heart contractions, but that requires intensive monitoring.
Okay, that's for severe cases.
Yes. For managing heart rate, if there are rapid supraventricular tachycardias, like atrial fibrillation, a drug like diltiazem can be used, often IV initially, then orally, to help slow the rate.
Diltiazem.
For dangerous ventricular tachycardias, lidocaine might be used as an IV infusion acutely, but carefully, watching for side effects. And then there's pimobendan.
Pimobendan, I've heard of that for dogs with heart failure.
You have. It's widely used and approved for dogs. The sources do mention it for cats with RCM and heart failure. It has effects that both increase contractility and dilate blood vessels. However, and this is a big caveat, it is not currently approved for routine clinical use in cats.
And approved. Why?
There's just limited, robust data on its safety and long-term effectiveness, specifically in cats with various types of cardiomyopathy, including RCM. So while some vets use it off-label, it's done with caution.
Okay, good to know. What about the blood clot risk?
Yes, very important. Anti-clotting medication is usually recommended, especially if the left atrium is severely enlarged or if that smoke is seen on echo. The most common antiplatelet drug used is clopidogrel.
Clopidogrel.
Sometimes, in the hospital setting initially, an injectable anticoagulant like heparin might be used as well.
Wow, quite a cocktail of drugs potentially needed just to stabilize them. What about the chronic, ongoing medication plan for cats living with RCM?
For long-term therapy, The goal is usually to find the lowest effective dose of furosemide that controls the signs of congestion, often given once or twice daily by mouth.
Tapering it down.
Exactly. ACE inhibitors like enalapril or benazepril are often added.
What do ACE inhibitors do?
They help counteract some of the body's neurohormonal responses to heart failure, can help manage fluid retention, might allow for lower diuretic doses, and potentially counter some side effects of diuretics like potassium loss.
Okay, so they work alongside the diuretics.
Yes.
Yes.
Diltiazem might be continued orally long-term if needed for heart rate control or specific arrhythmias. If a cat has persistent atrial fibrillation, another drug called digoxin might be added to help control the ventricular rate, the speed the lower chambers beat. For significant ventricular arrhythmias, a drug called sotalol, which has beta blocker and antiarrhythmic properties, might be used, although beta blockers in general are often approached cautiously in RCM.
Right, you mentioned avoiding beta blockers earlier.
Generally, yes, especially in overt heart failure, but sotalol is sometimes considered for specific rhythm issues. Pumobendin is again mentioned for potential chronic use, but with that same caveat about being unapproved and needing more data in cats.
Okay.
And addressing concurrent issues is vital, like making sure the cat isn't getting dehydrated from the diuretics or supplementing potassium if levels get too low. And then there's the long-term anti-clotting strategy.
Clopidogrel again?
Usually, yes. Long-term oral clopidogrel is the standard approach to reduce the risk of AEE. Aspirin is sometimes considered maybe in addition to clopidogrel in very high-risk cats, but its effectiveness as an antiplatelet in cats is more questionable than clopidogrels.
So clopidogrel is preferred.
Generally, yes. Interestingly, the sources note there isn't much info on treating cats in the early preclinical stages of RCM before CHF develops.
Right.
But if diagnosed early, treatment might involve just an ACE inhibitor and maybe clopidogrel to try and slow progression or prevent clots, although evidence for this is limited.
Right, and it's crucial to remember what you said earlier. None of these drugs actually fix the underlying stiffness, do they?
That's the key point. There is currently no specific treatment that directly addresses or reverses the fundamental problem of diastolic dysfunction, the impaired relaxation in feline RCM. All these therapies are aimed at managing the consequences, the fluid overload, the arrhythmias, the clot risk.
Managing symptoms, not curing the disease itself. Are there any drugs that should absolutely be avoided, or situations where certain drugs are contraindicated?
Yes, definitely.
Oh.
As mentioned, beta blockers as a class are generally contraindicated, especially in cats with active or recent CHF, because they can reduce contractility and slow the heart rate too much.
Okay, no beta blockers generally.
Diltiazem should be avoided if the cat has a very slow heart rate already, certain types of heart block, severe low blood pressure, hypotension, or very advanced heart failure.
Right.
Furosemide needs extreme caution or avoidance in cats that are severely dehydrated, have dangerously low potassium levels, hypokalemia, or significant kidney failure, renal insufficiency, or azotemia.
Makes sense. It could worsen those things.
And similarly, ACE inhibitors should be used very cautiously or avoided if the cat has significant kidney dysfunction, low blood pressure, or high potassium levels, hyperkalemia.
So careful patient selection and monitoring are key. What about drug interactions? Can using these medications together cause problems?
Yes, there are potential interactions to be aware of. Combining ACE inhibitors with high doses of furosemide, for instance, increases the risk of developing low blood pressure, worsening kidney function, and causing high potassium.
So vets need to monitor kidney values and electrolytes closely when using both.
Absolutely. And using aspirin long-term alongside an ACE inhibitor might potentially increase the risk of kidney side effects from the ACE inhibitor, and aspirin itself can cause appetite loss or GI upset in some cats.
Okay, so definitely things for the veterinary team to keep in mind when formulating a treatment plan. What does the ongoing long-term monitoring look like for a cat with RCM?
It involves regular checkups, definitely. Frequent reevaluations are needed, especially initially after diagnosis or a CHF episode.
How frequent?
It varies, but maybe every few weeks at first, then stretching out if the cat is stable. These visits are to assess how the treatment is working, check hydration, monitor kidney function and electrolytes via blood tests, and listen to the heart and lungs.
Checking for fluid recurrence.
Exactly. Repeat thoracentesis might be needed if pleural effusion keeps coming back. The owner's monitoring of the resting respiratory rate at home is crucial between visits. Repeat chest x-rays might be done periodically to objectively assess lung fluid.
And blood tests after starting meds.
Yes. Usually blood work, kidney values, electrolytes, is rechecked maybe a week or two after starting or changing doses of drugs like ACE inhibitors or diuretics. Once a cat is stable, reevaluations might settle into every 2 to 4 months, and repeat echocardiograms are often recommended, maybe every 6 to 9 months, to track changes in heart size and function over time.
So it's a continuous process of monitoring and adjusting. Now, the tough question, prevention. Is there anything owners can do to stop their cats getting RCM?
Sadly, no. The sources are quite clear on this. Because the underlying cause of primary RCM in cats is unknown, there are currently no known preventative measures.
Nothing related to diet or exercise or anything like that.
Nothing specific that's been proven to prevent RCM development? No.
That's difficult news. What are the main complications owners and vets need to watch out for down the line in cats living with RCM?
Well, the thromboembolism, the ATE, is a major one. Even with preventative medication, clots can still occur, potentially causing tissue damage, loss of limb function, severe pain, and sometimes leading to euthanasia.
That's grim.
Adverse side effects from the chronic medications are another potential complication. Kidney issues, electrolyte imbalances, GI upset. There's also always the risk of sudden cardiac death, likely due to severe arrhythmias. And ultimately, progressive refractory heart failure, meaning CHF, that no longer responds well to treatment can develop, which often leads to a decision about euthanasia based on poor quality of life.
It sounds like a condition with a very challenging outlook. What's the general prognosis?
The sources state that the prognosis is quite variable between individual cats. Some might respond well to treatment and have a reasonable quality of life for some time, while others may decline rapidly. However, overall, for most cats diagnosed with RCM, especially once they've developed CHF, the prognosis is generally considered guarded to grave.
Guarded to grave. That's sobering. It really highlights the severity of this, even if it's relatively uncommon.
It really does. While treatment can manage symptoms, often significantly, and improve quality of life, it's typically a progressive disease and unfortunately not usually curable.
Okay, so let's try and wrap up this deep dive. We've explored feline restrictive cardiomyopathy, RCM. It's this rare but serious heart muscle disease where the main issue is the heart's inability to relax and fill properly that diastolic dysfunction.
Right, leading to that stiff ventricle and those characteristically enlarged atria.
And this causes major problems like congestive heart failure, fluid buildup, and a really high risk of those dangerous blood clots, ADE.
Exactly. Diagnosis can be complex, involving ruling out other conditions using blood tests, x-rays showing that Valentine heart perhaps, but really relying heavily on echocardiography to see the structural changes and assess that restrictive filling pattern.
And treatment, well, it's not about fixing the stiffness itself, because we can't do that yet. It's all about managing the consequences.
Precisely. Using diuretics for fluid, drugs to control heart rate or rhythm if needed, ACE inhibitors, and critically, anti-clotting medication like clopidogrel, all aiming to control symptoms and hopefully maintain a good quality of life for as long as possible.
And while it's not common, owners should definitely be aware of those potential signs like sudden lethargy, difficulty breathing, fainting, or especially that sudden limb weakness or paralysis, and get veterinary help immediately if they see them.
Absolutely crucial for seeking timely care.
And it really is fascinating, isn't it, that despite knowing RCM has genetic roots in humans, the fundamental trigger, the primary cause in cats, is still basically unknown.
It is. A real mystery still.
It definitely sparks curiosity, what kind of research is needed, what avenues might finally unlock the secrets of why some cats develop this specific stiff heart condition. Understanding that could be the key to perhaps one day finding ways to prevent it or develop therapies that target the actual underlying problem, not just the downstream effects.
That would be the hope. Absolutely.
It just shows when you look at heart health across different species, there's still so much complexity and so much more to learn.